So who would have ever known? I used to run the Melbourne Headache Clinic. So if you just thought I was a guy who dealt with biomechanics of spines and shoulders and knees, what you didn't know is I used to run and own the Melbourne Headache Clinic. So I did that for many years. And this morning, my dear Julie, she wakes up and we're having breakfast and she tells me she has a headache this morning. All right. She said, I think I need a new pillow. To which I answered, bullshit. What's been happening is during this lockdown period, you're spending far too much time sitting down, looking at your phone, looking at your computer, and your posture is producing this headache. Now, there's a particular style of headache. This is what's happening more during the lockdown, people, where the change of head position is encouraging the production of headaches. So how does this all happen? A bit of anatomy before I teach you how I used to get rid of chronic daily headaches that were related to some postural issues. All right, well, as you can see, here's a spine. That's the back of your skull, and there's the side. Well, on the side here we have some joints, and the joints and some soft tissues. In fact, what really happens is there's a descending nucleus from the trigeminal nerve, and this is called the trigeminocervical nucleus. Basically what happens is the sensory fibers from the upper neck are actually synapsing very close to the trigeminocervical nucleus. And it's this convergence which produces pain along the trigeminal nerve distribution. So you can have the mandibular, the maxillary, or the ophthalmic distribution. And this is what happens with this chronic style of headache that now seems to be happening more during lockdown, where people are getting headaches. So there is a mobilization technique that's quite easy to perform, and I can teach you that you can do yourself, that can almost immediately get rid of and keep your headaches at bay. So back to my history as a headache man at the Melbourne Headache Clinic. I'm going to take you back and I'm going to show you how we mobilize an upper cervical spine and get rid of these postural headaches. Okay, so I'm going to really show you my retraction technique. This is basically extension of the lower cervical spine and its flexion of the upper cervical spine. So C1, 2, they flex and the lower cervical spine extends. So this is an interesting movement where we're going to actually get Julie to sit up nice and tall. And what you can see here, Julie's chin is slightly forward. I want you to retract it there, won't you? Good. Now Julie's retracted. I put my hand on the mandible and I retract. Bit of overpressure. Julie retracts. I apply a little bit of overpressure. This is stretching the upper cervical spine into flexion. Now I've just done that with my hands. Julie can do it to herself. So put one hand around the jaw, and as you retract, you add a little bit of overpressure. That's just pressure on, pressure on. There we go, and now pressure off. Pressure on, pressure off. You can relax from that. Now we return to a good sitting posture. What we did then, we basically overpressed slightly, cervical flexion of the upper cervical spine as the lower cervical spine extended. This then decreases the sensory input into the trigeminocervical nucleus that can produce the headache in the trigeminal nerve distribution. And I bet you thought I only lifted weights. I'm super smart on headaches. Stay big, train hard, enjoy the solution.